All right. Well, folks, thanks for joining me. Back at it. I know that the situation isn't exactly the best right now, but I'm trying to remain upbeat, keep myself busy. I'm trying to keep myself informed. Thank you for joining me. My name is Daniel Whitelock. I'm a physician here in Northwest Arkansas. I just wanted to give my take on what's going on as far as this coronavirus, this SARS-like coronavirus, COVID-19. I know it's going by a bunch of different aliases, but it doesn't matter. Everyone knows what we're talking about. It's it's avocado toast of news right now. So, what's going on? I'll jump right into it. Okay, so numbers wise, we'll hit on that first. What to look for if you're ill, what to do if you're well. All right, just the big stuff. I don't want to pull any punches. I want everyone to be on the same page. I don't want people to overreact or underreact. The best thing to do is just use your good knowledge, okay? Right now is natural selection time. People who take heed will fare well. People who do not will not fare well. So, be mindful of the sources that you listen to. When in doubt, always land on the CDC's website. They're putting out regular information, updating daily, probably multiple times a day. So that's where the best practices can be found. The CDC is where you're going to find the latest information and what to do and what not to do, what to look for in terms of symptoms, and what to do if you are well. All right, and we're going to cover those things today. Okay, so numbers wise, 33,000 confirmed cases in the United States, 428 deaths. That is as of today, March 23rd, Monday. Those numbers, whenever you watch this, of course, those numbers are going to keep going up and up. There's no way to get an accurate number of actual cases because many cases will not present, and a lot of cases are going to be staying at home with just presumed positive. That's basically what the CDC is saying. If you have mild cases, to pretty much doctor yourself at home. And I'm going to try and go over that best protocol in this video as well. I have a whole lot to cover. I'm not sure if I can cover it all in one video, but I'm going to do my best to cover everything at some point. Okay, so we'll just try and be patient. All right, so back to Arkansas, because I'm in Arkansas, so I want to get good Arkansas numbers. 168 cases in Arkansas. That's as of today, March 23rd. No deaths. Thank goodness, no deaths. Okay, so 168 cases, no deaths. Most of them are sort of centered around Little Rock, Pine Bluff area. Pulaski County, 52 cases, 5 in Washington County, 1 in Benton, 20 in Jefferson, 25 in Cleburne, 9 in Garland. Okay, so that's the Arkansas distribution. No deaths. Okay, so keep up the good work. Again, going over protocol, social distancing, 6 feet. That's 2 arm lengths. Okay, that's protocol right now. It's encouraged for people to stay inside, but we do not have an order in the state of Arkansas. We do not have an order. You're encouraged to stay inside. Only absolutely necessary activities. Vigorous hand washing. You know, that's 20 seconds. Hot water, longer the better. Soap, you know, any kind of soap will work. Detergent, dish detergent, laundry detergent. Just get some good soap on your hands. Make sure and keep the hands moisturized so that you can protect that essential barrier. As long as you don't inoculate your face, then you guys should be good. Just be very protective of your hands because these are the vectors more than anything else. Being cautious how you sneeze and cough. If anything, direct it downward, not upward. Into your sleeve is more recommended than into your hand, but either way, wash your hands after. Better than into the sleeve, in my opinion, is under your shirt and down. What you want to do is contain it from rapid spread. Okay, that's the whole idea. If you were to do it any way, you want to direct this down towards the ground and away from where people might catch it into their respiratory tract or inoculate their hands, and then their hands become a vector to either inoculate their own face or touch someone else and spread it that way. Okay, so good practice. Again, you guys, folks, we are allowed outside. I would encourage less dense spaces. If you want to go for a hike or a jog, getting that good oxygen into your lungs and getting good respiratory practice and letting the diaphragm exercise. Really good practice. Okay, you just still want to practice the social protocol of the distancing. Okay, that's the important thing. As long as you can keep the congregation to a minimum, we'll be able to flatten this curve, all right, and limit the person-to-person contact, isolate these cases that are confirmed, and keep the people who are sick or who might be contagious and transmissible of virus. The key is to keep them sequestered away from other folks. I know that there are a lot of spring breakers that are going to be coming back from places where people were not adhering to the social protocol of distancing and limiting contact. So you can't expect the cases to rise. So that's why I don't see any end being near at this point. And I can't assume that people are going to be able to get their hands on preventive measures like hand sanitizer, that kind of stuff. We still should be able to get by without that. I'm sure we're going to be able to stock and supply and get people ready, but assume that there are going to be vectors out and about getting other people sick. So don't depend on other people to follow protocol. Okay, there's always going to be bad actors in this tragic comedy. So those are the people you want to look out for. All right, maintain your distance. The less you're in contact, it's a numbers game. The less you're in contact, the better off you'll be. If you're well now, take advantage of this time. We'll get on that a little bit later. Okay, so let's dig into the symptoms. Okay, what are we looking for here? Okay, how is this different from your regular influenza A and B, our regular influenza flu? Okay, and this new coronavirus strain, this SARS-like coronavirus strain that we're dealing with now, this COVID-19 as it's called. So big thing to look for, all right, so I'll just jump right into it, is its predilection for the respiratory passages. All right, it apparently incites this very robust inflammatory reaction, this cytokine driven inflammatory reaction that is an acute respiratory distress-like reaction, an ARDS-like reaction that can lead to cardiopulmonary compromise, organ failure, what have you, all the way up to death. Okay, so the important thing to remember if you are feeling ill, number one, is to just adhere by the social isolation guidelines, number one, and vigorous disinfection of your doorknobs, keeping yourself quarantined from other people, that sort of thing. Okay, even if you haven't had a positive test. Okay, that's the important thing. If you are symptomatic, still to adhere to those guidelines. Okay, because some people have a lag time of 3-4 days between when they feel symptoms and when they can get a positive test, and by the time they feel symptoms, they have already had this virus in an asymptomatic period. They've already had this virus anywhere between 2 and 14 days. So there could be a lag time of up to maybe 20 days between when they are inoculated, when they have the virus replicating in them, and them get a positive result. Even if they actually get a positive result. So most will not. Okay, so basically what that means is if you're having mild symptoms and you can take care of yourself and doctor yourself at home with symptomatic therapy, and we'll go over that, then it's advised that you stay home. If you're having respiratory compromise, if you're short of breath, if your oxygen saturation goes down, if you have a device to measure that, but if you're increasing your work of breathing and you can't catch a breath or get a deep breath, and you're experiencing confusion because of lack of oxygen, or if you've gotten to the point where your lips are starting to turn blue, or signs of cyanosis, meaning you're not getting enough oxygen, you're decompensating. You've waited too long at that point. That's emergency room time. Okay, so if you're a person that has pre-existing respiratory symptoms like COPD, asthma, you're in the higher risk group. You need to be more vigilant. If you have underlying immunosuppression, those are the folks that need to be vigilant and be watchful for. And those are the folks that we want to keep the ERs open for. Okay, everyone else that can be treated mildly, the trick is just stay hydrated, stay on top of your nutrition, stay on top of your pulmonary toilet. Okay, by pulmonary toilet, by this nasty word, what I mean is coughing, deep breathing, being able to get a deep breath, and just maximizing the amount of oxygen exchange that you're getting. Okay, if you're sitting in your bed, I'd recommend propping up a couple of pillows so that you're elevated about 30 degrees. Okay, instead of laying flat, so that you can aerate those lung bases. You want to be able, the name of the game is being able to get good air all the way to the bottom of your lungs. When we're seeing people decompensate and have worse outcomes, it's because these people cannot effectively aerate the bottom of their lungs, and then they tire out from hyperventilation. And when their lungs can't ventilate anymore, their heart starts beating faster to meet that oxygen demand. Then eventually the heart just gives out too. So that's what we're seeing. We need to maximize your respiratory status. If you have an incentive spirometer, which is a device that some patients, either post-op or pulmonary patients, will use to ensure that their entire lung takes a deep breath. Okay, it looks like a little straw type apparatus where you pull on it and the plunger will rise and fall depending on how much volume you can take into your lungs. Excellent device to maximize lung function. Apart from that, if people are able to do cardiovascular exercise and they're healthy, recommend that they do so now. But getting back to those who are sick, Tylenol for fever, maximizing lung function. If you have an essential oil vaporizer type apparatus, good terpenous things like limonene, citrus oil type things like limonene, pinene, which has bronchodilatory properties. Those things can always help to maximize function and keep people breathing deeper. Getting up and walking around is not contraindicated. You just don't want to have face-to-face contact with people too much. The more that you can get up and out of bed and get the entire lung aerated and take deep breaths, you will fare better. The main important thing is to make sure and stay hydrated, get good nutrition to support a good immune system. If you are ill, even if you are well, now's the time to think ahead. But the amount of nutrition that you can get to ensure that you can still produce enough antibodies and have enough cytotoxic T cell response, the whole response, the whole immune response requires good nutrition, because you're going to have higher demand. You're going to have higher metabolic demand if you're feeling unwell. So keep that in mind. Your nutrition is going to make a difference. It's better to eat anti-inflammatory foods, the healthy foods that you know of already. I won't go through it A to Z, but you want to maintain a very healthy diet. Now is not the time to play half-wit. Don't do the jackass diet. Do the right thing, okay? We'll cover the well folks, what well folks should do. Probably cover that in the next video. I know I've given a whole lot of information with this, but I do want to keep it comprehensive and tight. So hold on to that for now, folks, and I'll try and give you guys a little bit more information in the coming days, hours. We'll see, all right? Y'all be well. Take a deep breath. Don't freak out. It's going to be okay.